Um, my staff, I wouldn't have them stupidly on the phone arguing about something we made a mistake on. Obviously, the billing code was wrong. And I was like, obviously, you didn't listen because we're talking about Quest.
Mm-hmm.
Good morning. And that really helped us get over the slump.
Good morning, everybody.
Let's see.
I do have to tell you that that in one of the many 11 and a half hours I spent yesterday, the other side brought up our TikTok. Yes. So they're following us. Good morning,
Hey!
Right?
You're like, that's not even mine. Why are you following one of my employees?
It's because they just think I'm a bitch. And I am.
That's so funny.
Yeah.
This is personally mine. I just talk her into getting in it.
Right.
And I give her a little script of what we're trying to say.
And then she does whatever the hell she wants.
Because you can't control me. Ask my aunt.
Whew. No one can control anyone. Okay. All right. I am coming for Express Scripts this morning.
We're home of Express Scripts, so we're
Yeah.
huge fans.
Yeah, I'm actually going to email this to my contact at Express Scripts, who I keep emailing the leadership at Express Scripts because my friend gave me some of their email addresses, and they're like, get this lady off my Dick Van Dyke.
We just show up there like,
I told her, I said, look, you're in Missouri, you're in St. Louis, Missouri, I'm down the street from you.
Let's meet at Breadco.
No, I don't want to meet at Breadco. I want to go into the Express Scripts leadership building.
I would
want
like
to
to walk
sit at the
through.
table. I want to sit because
I want to sit where, who's the executive?
Adam.
I want to sit at the president's side of the table where Adam sits.
I'm
Stick your
gonna
feet up.
ask him if I can come meet with him.
And it would be amazing if you were just like, this is what I want.
I would just be like, hey, can we do a selfie? You know, he's never gonna be in the same room with me, but I'm gonna ask because that's what I do. I ask. I start by asking
Nice.
nicely. I start by following everyone's dumb protocols with insurance companies and pharmacy benefit managers of the appeal, the chart notes, the letter of medical necessity, the faxes, the carrying the one, crossing the T's, dotting
your
I's, like all of that nonsense. And when they continue to algorithm denial or physically have a medical director like deny in 4.2 seconds or whatever they do, then we go to take it up a notch. And by taking it up a notch, we go to social media, we redact cases, we go to the employer of the self-funded group. Like,
Wells Fargo is getting sued.
yeah, they are. I think Wells Fargo is suing.
Oh.
I thought it was an employee of Wells Fargo
Yeah.
who was suing Wells Fargo.
Yeah.
Yeah. And it's the same thing Cuban talked about this. Mark Cuban.
That's the
Love
love
to
of my
have Mark
life.
Cuban here.
Love of my life. I won't even hit on you, Mark. I know you're married. I just
He's like 67.
want to be your daughter.
Oh my god. Yeah, I think it's let's see. I think Wells Fargo
But these huge companies, an employee is seeing that they can sue their employer.
Well, they can.
And they're doing it. It's going to start happening all over the place. And
Mark Cuban said that any self-funded employer that is mandating to a pharmacy benefit manager is really in trouble here. Okay, so here's the thing. Wells Fargo relationship with Express Scripts is under scrutiny in new lawsuit. It's great. Former employees are suing Wells Fargo in a class action lawsuit, okay, for the lack and for the company's executives not fulfilling its fiduciary obligations under ERISA. ERISA is the governing body. I don't know what it stands for, but I mean I should.
It's basically.
Oh, here it is. Okay, it's the Employee Retirement Income Security Act, ERISA, Employee Retirement Income Security Act of 1974. All right.
I wasn't even alive yet.
Right. Well, so what that is that's the rules, the laws that manage self-funded employers. And what they've done, and what Express Scripts, Optum Rx, and CVS Caremark have done for decades, is con executives, or maybe they're on the take too.
Or maybe
they might be.
They're just out playing golf, had a little bit too much to drink. He's like, Jerry, sign this.
Right. Okay. Done. what they do is they're mandating to themselves, right? And so instead of letting patients shop for prescriptions, they are mandating them to spend their hard-earned after-tax dollars, the employees, the patients' dollars, on hi puppy, I like that, on prescriptions that you can only get at whatever pharmacy benefit manager, PBM, in this case, Express Scripts. So this is number 2 that we know of. And
Well,
if there's 2, there's 200.
And with the Humira and CVS Specialty making everyone go to their manufactured drug,
Right.
I mean, if your employee is prescribed Humira and doesn't want to switch, couldn't that like light it up too?
You
Because
know,
it brings attention to the PBM.
I mean, it's all a frickin' shell game, but I think that we are on the cusp of overturning this like they did a decade ago with the 401ks. So, the employees say in the suit against Wells Fargo that they were forced to pay nearly $10,000 for a prescription of flingolamine used to treat MS when the generic version could have been purchased without insurance for $1,000 at Mark Cuban's Cost Plus.
Mark Cuban is he's kind of shaking the cage because of his cost plus drugs.
It's amazing. In the lawsuit, it says, no prudent fiduciary, that would be the CFO of Wells Fargo, would agree to make its plan and participants pay a price that is 15 times higher than the price available to anyone who just walks off the street. That, folks, is amazing.
Healthcare.
That is healthcare.
And
I just got a picture of this from our friend Shayla.
I didn't even see the mustache.
Moustache.
Ah.
Thank you, Shayla.
Shayla, thank you.
I love a moustache. Love.
You can tell we get jealous. It's
Yeah.
me getting jealous more so. But
Yeah.
So-
Well, at least your fingernails are in it.
Look
right?
at this.
Thanks, Shayla.
Hi. So I think we're gonna record like a lot of the phone. I think it's good cop, bad cop. People clearly like that.
Well, you're the good cop?
I was the nice one, and I'm like,
Oh.
oh, you want to talk to
No.
my manager?
Listen.
And then you're like, you think Claudia's attitude was bad? You want to rewatch it? I cut it.
Okay.
Let's
so,
have her watch it.
Okay, I actually haven't seen it. I actually haven't seen it ever. How long is it? I don't
It's
want to waste
like
everyone's
60
time.
seconds, but
60 seconds? Can everyone hear and stand for this? I know
Yes.
it's a lot.
I mean, I sit over there silent, and they do. So I'd imagine.
Okay. Can't wait.
Okay.
Would take care of it. You don't have the doctor's office. Do the administrative burden because you guys messed up.
This is what Claudia's doing. Is this on something?
It's on our TikTok.
It's on TikTok.
That's terrible patient care. So like a 90-year-old comes in and you're not gonna help them.
No, someone in there says, I can hear her talking about a different company in the background.
Yeah, with the last initial, please.
I
You
need
are-
so much help with prior authorizations. How do you do it?
She's the nice one. I'm the mean one.
I know someone comments on it and was like, Claudia, you were respectful. That I just
Cause
thought,
problems.
I don't do nothing but cause problems.
Your hair looks good in that too.
Better than this.
Can
You
they
wanna
see
talk to
this?
her?
Yeah, it's on our.
Oh yeah, this is it.
I'll get her on this phone.
My
call.
face,
I mean,
I'm like, oh.
So, but we're speaking with you, that you don't tell them to call the physician's office. We have nothing to do with this. You guys are like, you're doing the wrong thing. My name is Julie. I'm the practice manager and the bathroom monitor. My
Someone
title?
was like, I fell off my chair.
This is too
Yeah,
long.
my last initial
It's-
is B as in
it's almost over.
broomstick. And if you think Claudia had a bad attitude, you're gonna love me.
We couldn't miss that.
Well, I'm providing customer service. You're the one not providing customer service.
Ooh, you can hear her.
Barely, I know.
To bill a patient $3,000 for a nonsense test? Yeah, that's not an agreement. And for Quest to turn around and tell the patient to call the doctor's office? No, that's not cool. So, I understand that you're reading from a script, and I respect that because everybody has to make it.
I'm
This
not.
isn't a script.
This isn't a script.
I go,
I'm knowledgeable too. I know. Whoa.
That's great.
This is every day.
It's every minute.
Oh my gosh, sometimes I'm on the phone and I'm like, oh, there's laughing in the background. I guess one of their patients aren't dying.
Yeah, so I have a notice
Oh.
of final determination of an adverse benefit. They're gonna so hate me,
They already
okay?
hate us, I think.
Yeah, so,
Oh my gosh.
yeah.
C-Money 636 is really rattling some cages.
Yeah, okay, so we just got, can they see this or is it on the thing? Why are you using Dr. Bach's cup?
Is it Dr. Bucks? There's
They're
like
all from
7
my
clear.
house.
I know, they're my favorite.
This is something that I got on my desk when I just walked in here. I was gone all day yesterday at a horrible meeting. But this is Express Scripts. Notice of final internal adverse benefit determination. Do you know how garbage this is? This is like algorithm
In the back
stuff.
is NA. Did you see the back of it?
NA? Oh yeah. Yeah.
Just nothing. Denial codes 9999.
Yeah.
Figure it out.
This is, we don't know what code to use to deny you. We're going to just say, forget it.
And it's not just Express Scripts. It's Accredo. It's
Well,
OptumRx.
Oh,
It's
Express
CVS
Scripts
Special.
owns Accredo. Did you know that?
I'm not surprised.
Okay, well, so let me see. I'm going to be sending this to,
Wow.
yeah.
Well, and then we also, I thought that one that we got at the end of the day, where it's like, we're reviewing those appeals to see if we're going to pay for them or not, because it has been decided you never had a second or a primary insurance, but we still have to review and see if we're going to pay these.
So if you wish to appeal the final adverse benefit determination from Express Scripts, we do. We can do that with
How do I fight them on a denial? They told me I've exhausted my appeals.
no.
Send me your email or your phone, or email me your phone number and we'll call you.
Yeah, there's always, this is when you pivot to social media, okay? We could actually, we'll take a look at your case and maybe
Go
we'll go live and take a look at it and show the documents. They like to say you've exhausted everything, but the reality is, the first time you appeal, 50% of the cases are overturned right then and there. So where do I work? I work in that 50% that they say no on. And I think we've got that down to, I don't know.
25?
More than we've got. I think we're only dealing with about 5% of our patients that continue to get denied. I mean,
And
like,
those,
look at
and
it,
they're
there's-
really sticking their foot down on them. They're like,
Yeah, but
"Nah."
this is Quantum Health. We see you. Party City. We see you.
Don't go to Party City right now. It's not a party.
No, well, they don't give a rat's behind about their employees. I can tell you that based on this one we're dealing with. But
She's magical. We are here to help you.
did you know that our friend, our patient that is a Party City, her father got shot 8 times? Yeah, earlier in the week.
This week?
Yeah, this week. Yeah. So
Jesus.
I know. So she's got a whole lot to deal with.
And that causes you to flare up when you're stressed.
Yeah.
And
Well,
if she can't get her medicine, Party City obviously doesn't care. Condolences.
Quantum Health doesn't care. So yeah, we've got to deal with that. But yeah.
Yes,
I mean,
Carmelo, Party City. It's where you get, a lot of people get party supplies there. I thought they closed down a while ago.
well, they actually are in bankruptcy for restructuring. But I think that Quantum Health, who is an
FDU.
interloper of an interloper, they have Lucent Health, which is an interloper, Quantum Health, which is an interloper, that sit in between all of these.
Why do you need
patients.
5 interlopers?
You don't. It's just literally skimming healthcare dollars that are supposed to be direct patient care dollars to themselves. That's
like-
what a pharmacy benefit manager in the world, according to me, does. So
Say it with your chest. If you're the CFO and you don't want to pay something,
say
it with
it
your
like
chest.
your chest.
Say it with your chest. Like, say it proudly. If you're not going to do something, be
don't-
like,
these
you know
peop-
what? I suck. I'm sorry, but I need more money.
The Express Scripts CEO, Adam, is underneath his desk in a tornado drill position because he doesn't want to come out and have a conversation
I wonder
and
if I
say
could call and ask to set up an appointment.
they're not taking your call.
They don't know why I'm calling. I'm just
They
like,
don't care why you're calling. You are not getting in there. I mean, our best bet is to continue to email him until he does something. But I will. He'll
maybe
probably
I'll find,
block me.
maybe I'll match with him on Hinge.
Oh my God.
I just start going on the dating app looking for him. Cigna's freaking person was on there. I was like thinking
Cigna.
about matching with them. Just, networking.
So we've got a lot of review today. I was out of the office all day yesterday, and I was out a half day the day before that. So
Not really. You kind of left a little later than
Well-
usual. It felt like 2.
It was 2:15.
So I tried to tell Dr. Buck to go for his appointment because
And
he
he told you
He
no.
goes, my appointment at 4. And I was like, let me go double check.
Well, the good news is I've actually moved all of his hairdos to 5 now because I can't handle the stress and the phone
Because if
calls.
she's not here, Dr. Buck's like, I'm not listening.
He listens to no one. He barely listens to me.
Sometimes he's like, he was in with a patient for too long, and I was like, I did that. You want me to close you? And he's like, I'm fine. And I was like,
Yep.
and then Tona was like, I'll go in 15 minutes if he's not out. And she goes in and he goes, not done.
To her too. Honestly, you know what? He is a handful.
I was like, thank you, Tona. It was humiliating when I did it.
It's hard to interrupt him because when you interrupt him,
when you
he's-
open the door, he just,
what?
and then the patient looks and I'm like,
You and
with
your
my stupid wave and smile.
Yeah. That's usually my job, to knock on the door when he's hit an hour mark with a new patient because he's got to move on. But there is no moving Dr. back on for the most part. He will do what he's going to do, and he's going to spend however much time he needs with the patient.
Beautiful hair.
Mine or yours?
It's not mine.
I actually got a shampoo and set and a color. I have to get my hair colored every 4 weeks because I'm 100% gray. But I just did that on Tuesday. And and I've got a lot going on. We always have a lot going on, but I'm really excited to be back at work.
Your daughter's
because
getting married this month?
She is. On August 24th.
Oh,
You're not going.
I am.
You're
Sarah
not.
sent me a plane ticket.
She did not.
I'm her maid of honor.
That's Emma.
And I texted Emma. She called me twice the other day, and then I texted her. I was like, sorry, I was driving in a storm.
And what does she want?
I don't know. She didn't respond.
Emma and you are the same person, I hate to tell you. Like,
And it sucks because I'm neither mom or dad's favorite.
right. You might.
I'm
you
the
might-
redheaded stepchild.
You might be the dog's favorite. Because you don't have rules for the
Oh my
dog.
God, when I left the other day, and I'm like, Bunny, don't even think about it, using my deep voice, so she's scared. And then we saw this dog. How's my old man friend doing? I haven't seen him the past couple times.
He's fine.
I thought you were going to
Cantor-
tell me he died.
No, Dr. Cantor's fine.
She-
He's like 93.
She gives me the same face when she's saying it's fine or they're
Thanks
dead.
for the watermelons.
No,
or
we
cookies.
love those. That means
What's pizza?
so those are community hearts, and that means it's
Oh.
going to get shared to more people in our community.
Oh, well,
who
thanks.
will be on
Thank
their
you,
FYP.
Community Hearts. My glasses look like I slept in them.
This is Bubbles, my friend.
I am Bubbles. Bubbles today. She comes and picks up Bunny and me on Wednesdays because Dr. Buck plays tennis in the
I
morning.
almost just argued and said Tuesdays. For some reason, I can't get Wednesdays in my head.
I don't understand why you would ever.
Tennis Tuesdays.
It
was.
No, it wasn't.
It
It was
was.
never on Tuesday.
It was.
Claudia, why do you argue with me about stuff you know that I'm right on? Like, seriously.
I literally, maybe I dreamed it.
You did. He had never played tennis on
I
Tuesdays.
thought you guys used to both play, and then you moved it to Wednesday.
No.
Interesting.
You are wrong again.
I'll retract and redact.
Retract and redact. There's things you can throw down with me on, and then there's things you shouldn't even, like, open your mouth on.
But I like to open my mouth
Dr.
with
Buck's
both.
tennis schedule, don't even.
It used to be both of yours,
Right, until I had to quit tennis.
and
It's always been on Wednesday. Yes.
Why did I make the tennis Tuesday?
Because you had a meeting with yourself and came up with the
I
wrong
think they're
answer.
gonna move it to Tuesdays.
We're not. Okay.
So,
Anything else that we need to talk about before we
I
get
guess
to work?
3 tips on arguing a denial.
3 tips on arguing a denial. Okay. Get your denial letter or what the reasons are. You can, if you're a physician's office, write a letter of medical necessity. We need to do a whole thing on how to write a letter of medical
Yeah,
necessity.
we
It
can do
needs
that
to be
later.
less than 3 sentences, okay? Because no one's actually reading more than like the first 2 sentences, so it really should only be 2 sentences. Let's do that. Can we do that tomorrow? Because I'm actually having to work. Oh, you're not working tomorrow. I have to come in because Nick's on vacation, but that's okay.
I could come in.
Maybe just for a little bit, or not, whatever. I want to do how to write a letter of medical necessity, and then how to do the patient appeal. The patient appeal is the secret sauce. Okay, when everything else fails, you got to pivot to a patient appeal, and we're going to talk about this.
I think we should start with what to do with a denial. You know, go in the steps maybe, and we could do it every like once a week until it'll be like a series.
Okay. This is called
Don't back down
Appeals
denials.
Appeals 101. Let's do that. Okay, and actually, I would love to start with these fools at Express Scripts.
But do we need to explain, like, you know, with your slideshow how you have all the interlopers
Yeah,
showing?
for sure.
I feel like that'd be
Maybe,
good.
okay, so she's putting together a slideshow for myself and my colleague Nilsa.
Oh, I thought you were just saying she's gonna put together a slideshow that's gonna go over
No,
every house.
we can show you some of the slideshow, but I have to get it looked at and submitted today, and then maybe we'll show you guys. We'll show you 2 slides of the however many we're gonna have. I hope
Yeah.
we don't have too many slides because I don't really
I
like
cut
slides.
out like there's 6 now, I think.
Really? Okay. All right. Well, we're gonna do that.
We're gonna go look at it so before I
Right.
get in trouble because don't want that.
No, we don't want that. All right. Thank you, everybody.
Adios.
Fiddlesticks.